Thanks for WeShine, and I have a chance here to share my project. This is just still a project, but it's related to my company now. Let me introduce myself. My name is Qing Zhao, and this project I call it GenoMeCoin. You see, it's a combination of Genome plus coin. So you could see it's related to both. And actually, I designed it as a genetic diagnosis AI platform for rare disease patients. So you may not know that there are more than 300 million rare disease patients around the world, and there are more than 7,000 kinds of rare disease. So it's a startup project, but it has huge potential. Okay, no problem. Okay, it's a 看你们随便 up to you. Okay. First of all, let me share important milestone of GenoMeCoin, also my company in China. Our first clinical trial for rare disease patients in China has been approved by the ethics committee in one of the biggest hospital, let's say Zhejiang province. Already enrolled more than 100 subjects, and we will enroll more soon. So all of my subjects now, they are eager to get the correct in-time genetic diagnosis. That's a tough job worldwide so far. Why GenoMeCoin? As I said, there are more than 300 million people worldwide are currently living with at least one kind of rare disease. No, most of them, more than half actually appear in childhood. So, and actually take more than 5 years to diagnose a child with a rare disease. So I see many desperate rare disease patients, especially childhood. Now, why GenoMeCoin? Because there's so many hospitals, so many physicians, so many companies, they are doing genetic diagnosis. Because a high cost of new drug development, for rare disease, also poor authority of orphan drugs, those most expensive drugs, especially orphan drugs, they are, for rare disease patients. That's why these patients are desperate. Why me? You see, there are so many companies, including those giant, pharmaceutical companies like, Roche, Pfizer, Takeda. They are all working on orphan drugs. Actually, they are all working on the same molecule as I'm doing now. But why me? Why should you invest in my project or in my company? Because I have experience of rare disease and orphan drugs, for more than 25 years. I worked as a physician related to rare disease, also pharmaceutical company employees related to rare disease orphan drugs, and now I already start my own business. That's from 2021 September. So you see, all my career I am related to rare disease and orphan drugs. Now, what's GenoMeCoin? I name it as equivalent for the value of everyone's genome. I don't like many, cryptocurrency. People call it L cryptocurrency because, they are only based upon calculation. But here, a GenoMeCoin, because every one of us, especially those rare disease patients, our genome and the patient's genome, they have intrinsic value. I'll give you an example. Some drug, for example, those to decrease our blood lipids level. They are starting from mutation research in one family. We found that their gene are mutated. They are not sensitive to those food and environment factors that most of us will be affected. So that's why, everyone's genome, also especially those rare disease patients' genome, will be, very expensive in the market. Actually, if my patient's genome, I could trade them freely in the market now. I need not stand here to pitch you. I would have enough money, to do all the, work. But because there are so many, laws and regulations, all the genetic data are heavily regulated throughout the world, including China, USA, EU. So we need AI platform to make the compliance around the world. Then why genetic diagnosis? I select this part as my project's point, because about 8% of rare disease patients are genetic in origin, and it means somewhere in their genome have problem, so it's caused their or maybe their family's disease. So they need genetic diagnosis, not only clinical or laboratory diagnosis. That's not enough. So genetic diagnosis is essential in most of rare disease patients. That's why I select the genetic diagnosis as the first function of the AI platform. Why I say the GenoMeCoin is unique? Because it's very intrinsic. It's not rely on the calculation or anything else, because everyone, including ourselves, our genome has its intrinsic value. It could accelerate the development of new drugs, especially for orphan drugs, and increase the acceptability of orphan drugs for rare disease patients. And after all, that's what I like. It will increase the wealth equity. It will not no polarization between the rich and the poor. The disease, especially genetic disease, will make many families poor for different generations and generations. So this is one tool for them, and also the hope. Actually, many companies they are already spend a lot of time and money on this, this kind of project. For example, this is a solution from Amazon. They already have, their platform online, but I think they already finished part of the work. For example, this is for everyone, not only for rare disease patients, but the problem for it, its data could also, its the value of the data could not pass through the borders. For example, it could only used to be in USA or used in China, that's fine. But once you want to pull the data of the rare disease patients in different countries, for example, in USA and in China or in EU together, that will add the very value to the patient's data, but it's very difficult. This platform are not enough. Even Amazon, very good player in this area, but not enough. Also, Google and Microsoft, they are also similar project. I discussed with some of them, but so far they not to launch a platform to make the data across the borders. I think the bravest project so far I see is to make the data flow within one country, for example in USA or in China. I do see several projects like that, but so far no project to across the borders. This is another solution, a little bit more complex, more expensive, but still it's not feasible to across the borders. And this is my project. What I'm planning to do is, for example, in a company of my company in China, I will set up online platform like this, and this is another part. For example, in USA or in EU, the tricky part is here. How to across the board? What I'm planning to do is I need to I set up a very strong team, and using the technique like privacy computing, federal learning, such as this. And the data on both sides could be combined together. Give you an example. For example, I need to increase the genetic diagnosis of my patients in China. If I could add those data in USA, there are already hundreds, maybe thousands in USA now, that will bring big advantage into my patients' genetic diagnosis in China. But I need not download the data to China or download my patient's data in China to USA. I need not do that. I only let those genetic diagnosis company know, for example, in certain position, what's the A or T or CG. And then they could give me diagnosis result. I could know whether the patients in China, they have the same or different genetic mutation as in those in USA. So that's enough for me at this moment. So that's what I'm planning to do. Okay, what I need? I need a seat. I already, have a team, not a company yet. We have team from different functions, like from pharma, from clinical, from IP, blockchain. But we need to set up a new company, have the seed, or angel investment. Then we are going to, launch this platform and list our coin or token. I think that's a quick way to put in money, and it should be enough to pay angel investors very quickly. So that's my plan. If you have any question, please ask. And this is the market planning. No, that's competitors. One of the biggest competitors is the DNA encryption. You could locate the information on website. You could see they enrolled, millions of US dollars at the beginning. But what I believe is because I focus on rare disease patients, and rare disease patients genetic data are much more valuable than those, normal people. So I think just for millions of US dollars should be much easier than the DNA encryption. And for Ancestry.com or 23andMe, especially 23andMe, I don't want to say too much. They sell their customer data to pharmaceutical companies. So that's illegal and not compliant. But you could see that our data in the market are very expensive. So that's it. Marketing analysis. So you see there's a huge demand for 2C rare disease patients. I told you that there are more than 300 million rare disease patients around the world. So you see how big the market is. And 2B, pharmaceutical companies, institutions, researchers, okay, they are all, very eager to get the genetic diagnosis platform, also data to develop the drugs or research. So the data is very expensive in market at this moment. Okay, for the stock, you could see for the DNA encryption, it's curve. They do include more than millions of dollars. You could search for detail on the website. And I'm recruiting, also I'm looking for talents. So if anyone are interested to cooperate with me to set up a new company in USA, you're welcome. You could work as CEO, CCO, or CFO anywhere. So I have to stay in China to take care of my biofarm business, and I hope someone in USA could help me out, to register a new company here. Okay, this is me and my contact information, email, also, WeChat if you like. Okay, any questions? Yeah, please. For the AI platform, we use not patient's data. We use those data from public database. For example, you could find 100G, 200G, or dozens of Gs genetic data from public database. For the patient's data, I believe it's the patient's property. Even you sequence them or you pay the money for genetic diagnosis or clinical trial, but my personal philosophy is it's still patient's property. So what I plan to do is once I set up this platform, I will give the patients freedom when and how much and to whom they would like to sell their data to. For example, if they like some company, the company develop a drug for them, they could donate the data or could they sell their data like at $10,000 or $100,000 to certain companies. That's fine for me. Thanks. What value yeah, data certainly. For example, for the patients' data in my clinical trial, they could cost up to 200 to 300 thousand US dollar each patient. So that's what, because I used to work for multiple national pharmaceutical company. Actually, I calculated their cost of the clinical trial. I calculated how much they need to spend to get one patient's genetic data. So that's about that. It's still a prototype. We are still testing it because it needs a very good hardware, software, high-speed internet connection between different countries, for example, between USA and China. No, no. As I mentioned, we are training our platform using the open database. We download those open database genetic data that's open for everyone. So we use them, no problem. It's compliance and legal, 100%. What do you hold? Data and the platform, the prototype also. Yeah. Very much impressed with your progress in the young 105, yeah. Okay. For example, based on this experience with 100 patients or even some initial conversation with patients, how do you price the genetic data? The patients, it's very interesting topic because the patients on one end of the patients feel like, tell me, I got this piece. If somebody can work on this, I will be very happy to share it. On the other end, the patient can be in a very different modality. They think, look, you got my data, you are going to develop a drug, you are going to make a food truck of money out of this. Yeah. So I only allow you to use my data. If you give me 100,000, you give me 200,000. Oh, 1 million, 2 million, yeah. Yeah. So how do you yeah, good question. I leave this question to the market. For example, just like you buy the stock in the market, somebody sold it, 10 times than the others, but it's up to the buyers whether what price you like to pay. For example, in my platform, I will let as I mentioned, I will let the buyers like the pharmaceutical company or the professor in the institution in the university or like other physicians that are doing research on a certain kind of rare disease and how much they like to pay. For example, if they want to conduct a clinical trial online, if they then they could purchase they give an offer. They are enrolling 100 subjects. Each subject they like to pay 100,000 US dollar to buy their data, including genetic data, clinical data, and then it's up to the patients. For example, in my platform, if there are 1,000 patients and 100 look, they like to sell their data or share their data in this price, then it's done. Just like you buy a stock, the other one wants to sell the stock at this price, then it's done. If there's some gap, then it's still up to them whether one buyer increase their price or offering and all the seller decrease their price. So I leave this question to the market. Yep, thanks very much.